Hello, my name is Chirag Shah. I'm the editor-in-chief of the ABS virtual platform. And today I'll be discussing the study Hyperthermia and Radiation Therapy in Local Regional Recurrent Breast Cancers, a systematic review and meta-analysis from Dutta et al. This was published in the Red Journal in 2016. In terms of an introduction to the topic, managing local regional breast cancer recurrences are extremely challenging. Whether patients have received radiation therapy previously or not, treatment discussions often include the role of surgery, the role of radiation or reirradiation, as well as systemic therapy and endocrine therapy. With respect to reirradiation, there are often questions regarding the efficacy of reirradiation, as well as the potential increased toxicity profiles associated with an additional course of radiation therapy. Hyperthermia is a well-known radiosensitizer and has been used for decades in the management of recurrent breast cancer. The authors of this study performed a systematic review and meta-analysis to evaluate hyperthermia in addition to radiation therapy for recurrent breast cancers. This is a summary of their literature search. They used multiple search strategies and initially identified 708 records. After screening, they identified a total of 31 articles included in the meta-analysis, including 26 single-arm studies and 5 two-arm studies. With regards to a summary of the studies included in the analysis, the average number of hyperthermias per week with 33 studies reported ranged from 1 to 5 with a mean of 1.9. The average temperature was 42.5 degrees Celsius with an average of 53 minutes of hyperthermia. The initial radiation therapy dose mean was 48.4 gray. The median interval was 55 months in cases of reirradiation. The radiation dose along with hyperthermia was average of 38 gray and the average dose per fraction of 2.8 gray, so a slightly more hypofractionated approach. As I mentioned, there were 31 articles which incorporated 34 studies. Of the initially discussed 5 two-arm studies, 3 were included as part of this single publication, hence the 8 compared to the methods where it showed 5, as well as 26 single-arm studies, 627 patients in the two-arm studies, 1,483 in the single-arm studies. As I had mentioned, there was a median of 7 hyperthermia sessions with an average of 42.5 degrees Celsius. With respect to timing, most commonly hyperthermia was given after radiation therapy, and the mean secondary radiation dose was 38.2 gray. In terms of the results, the complete response rate was 60% with radiation therapy and hyperthermia as compared to 38% alone with radiation alone, an odds ratio of 2.64 when looking at two-arm studies. And when looking at single-arm studies, there was a complete response rate of 63% with radiation hyperthermia. With regards to patients who previously received radiation, which was 779, the CR rate was 66.6% with hyperthermia and radiation. Importantly, toxicity rates were low. The rates of grade 3 and 4 toxicity acutely were 14%, while the late rates of toxicity were 5%. This is a figure from the study looking at the single-arm studies, looking at hyperthermia and radiation, and you can see a relatively consistent benefit with an overall odds ratio of response of 0.618. This is looking at hyperthermia plus radiation versus hyperthermia alone, and here you can see the odds ratio of hyperthermia and radiation as compared to radiation load being 2.64, with relatively consistent benefit seen between the studies, and really no study showing a benefit to radiation alone as compared to hyperthermia and radiation. In patients who underwent reirradiation and hyperthermia, again, you see a very good consistent response rate with a overall response rate of 0.643. In conclusion, hyperthermia with radiation increases the likelihood of complete response rates in local regional recurrent breast cancer by 22% as compared to radiation alone. There were low rates of acute and late toxicity seen. Patients who had previously received radiation therapy, radiation hyperthermia provided local control in 2/3 of cases. With that, I'd like to thank everyone for listening.